be 3, 2, 1, go.
Good evening, everybody. Welcome to the open evening at the Herts Essex Fertility Centre. My name's Sarah Templeman and I'm the nurse manager here at the clinic, and I hope that we can give you a little bit of an overview of what we're about and some of the treatments that we offer tonight. So first of all, what we aim to do this evening, so I will give a presentation mostly about what kind of treatments you can access via the clinic. We will, at the end of the presentation, give you a virtual tour of the clinic. But please be aware that we do have live questions and answers going on throughout the presentation, so you don't need to wait till the end to ask any questions. They will be answered live as we go through the presentation. So just some general notices, please all have your microphones muted and your cameras switched off. As I said, don't forget about the questions and answers. And at the end, there will be a link. We always love feedback at this clinic, so please do give us your feedback on this evening's presentation. Okay, a little bit of a update. So COVID-19 vaccination, we are still encouraging. It is absolutely the recommended thing to have. It is absolutely safe in pregnancy. We have enough research about it now. If you're recommended to have your booster, if you get called for a booster and you are accessing treatment, we absolutely want you to have it. So we're very clear about that, and the evidence is obviously getting clearer on that. So please do access your COVID-19 vaccination. So a little bit about us. We were originally founded as the Essex Fertility Centre back in 1989. The reason we changed our name was because we moved premises. And we are now in Hertfordshire, so we became the Herts Essex Fertility Centre. I think that was in 2007. So that gives us a lot of experience, 33 years of experience, and in that time over 6,700 babies have been born. We are a sort of medium-sized clinic. You'll get a fairly personal experience with us because we are a fairly small team, but we have all procedures carried out under one roof. So all of the procedures are within the clinic, and it was purpose-built for us back in 2007. So it is a state-of-the-art clinic. So we provide a full range of fertility services. We go all the way through, so we can provide just an assessment for your fertility status. We provide insemination, we do cycle monitoring through to full IVF, ICSI cycles. We freeze eggs and sperm to preserve fertility in situations. A big part of our work is donation, egg and sperm donation, and we have a very large surrogacy programme, probably one of the largest in the UK. Whatever treatment you have with us, it will usually take you right through to early pregnancy scan, and we usually will discharge you to usual normal antenatal services at 10 weeks of pregnancy. We do also offer some gynecological screening services, and I hope that the presentation will just give you a little bit of an idea in more detail of what we do offer. So moving on, I mentioned that donation is quite a large part of our work. We probably do about 100 cycles of egg donation each year. There's several reasons why you may need egg donation listed there. Sometimes age, or you may have early menopause, chemotherapy. Some women just have poor quality eggs, unfortunately, or born without ovaries. And as I mentioned, surrogacy is becoming an increasing part of our work, and most of our surrogacy work will be with donor eggs as well. We do have an in-house sperm bank. You can actually access that online to see our donors. Sperm donation is used for several reasons. If the man isn't producing any sperm naturally, if he's had chemotherapy, there are different genetic disorders that may mean that his sperm is not suitable to be used. Obviously, our single ladies will be accessing our donor sperm bank, as will our same-sex couples. Okay, so moving on to our fertility assessment services. This may be, you may want to access this, you're not quite ready for treatment, but you would like to know where your own fertility is at. Or sometimes you've been waiting a really long time for some investigations with your NHS doctor, and this is just a little appointment that you can pay for and access some of those tests that you're waiting for to save some time. It does involve 2 visits, and usually within a 2-week period you'll have both of those visits. So the first visit will include an egg reserve test. So we're having a look at that in 2 ways. We're having a look at that through your blood via a test called AMH, or anti-Müllerian hormone, and I will explain a little bit more about what that's about in a moment. And it also includes a scan of your ovaries to have a look at how many follicles you've potentially got available. So it looks at the reserve within your ovaries, both in your blood and physically. It also includes a 3D ultrasound scan of the uterus and a saline scan to assess the uterine cavity. We sometimes, depending on whether you require this, we would offer something called a high COSY, which is where we have a look to make sure that you have patent fallopian tubes. And for our male partner, obviously, we will be having a look at the semen analysis. So you can have, there's 2 different types of tests packages that you can access for a fertility assessment, including some or all of those tests. As I mentioned, the test AMH, so AMH stands for anti-Müllerian hormone, and essentially each little egg that is within our ovaries gives out a tiny amount of this hormone. So the higher your AMH is, the more eggs you have within your ovaries. So a higher level, so the picture on the left hand side is an ultrasound scan of an ovary, and each of those little black dots within that ovary are potential follicles that we can stimulate. So this is a picture of a lady with a high ovarian reserve, and when we have a high ovarian reserve, most of those eggs will be genetically normal. On the right hand side is an ultrasound scan of an ovary with a low AMH. You can immediately see that the ovary itself is smaller, and that there's perhaps 1, maybe 2 follicles on that ovary. And unfortunately, as our supply starts to run out of eggs, so does the proportion of genetically normal eggs that we have. So it's a very important fertility assessment for you to have. If after fertility assessment, or you come to us knowing that you would like to have a bit more in detail, we will book you for a consultation appointment with one of our doctors. You don't need a referral from your doctor or a gynecologist. You can self-refer. You can phone us up to book an appointment. And prior to coming for your appointment, we will ask you to do a few things. So we do have an online consent platform. We will send you some login details for that, and we will ask you to complete some forms online before you come along to us. We will ask on your first visit that you bring along copies of your passports. We are required to have photographic identification for all of our patients coming through. And importantly, we will ask for any relevant investigations that you've had so far. So in any fertility journey, it is a journey, and all of the steps are individual to you. So we're not going to make you repeat tests that you've had before. If you've had previous treatment, we absolutely want details of those, because each part of those investigations gives us information about you as an individual, to allow us to tailor your treatment correctly. The consultation takes place in 2 parts. The first is an in-person appointment in the clinic, and that's a nurse-led appointment where you will both attend together. You'll come into the clinic and you'll see a nurse. We will check height, weight, blood pressure, so a general health check for you. And at that same appointment, Your male partner, if you have one, will be asked to provide a semen assessment, and will either have arranged for a pot to be sent to you at home, and you'll bring the sample from home, or you can produce the sample within the clinic. We will also take blood for the AMH test, which I previously mentioned, which is included in the cost of the consultation. The actual consultation appointment with the doctor then takes place a week to 10 days after that, once the doctor's got all of those results, and it is an appointment via Microsoft Teams, and you will have an invitation sent for that appointment on the day of your consultation. One of the things you'll get details of within your consultation is how to log in to an app called Salve. This allows you to access information. It gives you appointment reminders. It gives you a secure messaging service to the clinic, and we provide this service for all of our patients. So as you come along for a consultation, you will get login details for the Salve app. The doctor may talk to you during your consultation about getting fit for fertility. So it may be that at this point in time, any treatment isn't necessary, and we need to have a look at your lifestyle, and even alongside obviously having treatment, lifestyle is important. I think we all know, the press has been quite good at letting us know that, you know, if we're overweight, underweight, if we have a poor diet, if we drink too much, if we smoke, all of it affects our fertility. So we have a website, fitfertility.com, where you can access some nice information on some lifestyle changes that you may need to make to improve your chances of a successful outcome. If the doctor has recommended to have treatment with us, whatever that treatment is, your journey really starts with a treatment information appointment, and this is a nurse appointment that takes place via Microsoft Teams. We do need both partners to attend. We do basically take you through an overview of what will happen during your treatment cycle. So by the end of that appointment, it lasts an hour with the nurse. By the end of that appointment, you should know exactly what you're doing, hopefully, if we've done our job properly. During that, we will plan out your treatment, usually, if it's possible, and book in all your further appointments and scans. We do ask you to link to our online consent platform, so we ask you to log in and then share your screen with us, and we complete the forms together online with you. Essentially, it's your best opportunity to ask questions, so you'll have the nurse to yourself for an hour, and as I say, by the end of it, hopefully, if we've done our job properly, you will understand your treatment pathway ahead. Important to know that free counselling is available for all couples going through treatment, and you will receive the details of how to access the counsellor during that appointment also. One of the first things that the nurse might book for you during that treatment information appointment is a 3D saline infusion scan. So this is where we insert a small amount of saline into the uterine cavity to ensure that there's nothing that would inhibit implantation within your uterus. So to make sure we've got a nice environment for any embryo that we're going to be putting back. The scan there shows a nice picture of what we call a uterine polyp, and these are very common to find within the uterus. You can't see them on a normal scan. It's only once you open out that uterine cavity that you're able to see and assess this. If at the beginning of your journey you do find that you've got a polyp, we are able to refer you for reproductive surgery to remove it. It may be a polyp, it may be some fibroids that are effective, and we are at one of our consultants. You will be able to be referred to one of our consultants who will be able to operate for you. Any treatment in the UK is governed by HFEA regulation, and that HFEA regulation requires that we screen both partners going through any fertility treatment for HIV, hepatitis B, C and chlamydia. We also additionally screen the female partner or the egg provider partner for AMH, which I've already discussed and is included back at your consultation appointment. And also we screen you for rubella, and we check a full blood count to make sure that there's no anemia or anything like that. The regulation currently states that if this is your first treatment cycle, the results must be in date within 3 months of starting treatment, and they have to be carried out through a UCAS accredited lab. So obviously the lab that we use is UCAS accredited, but if you're wanting to bring external results to us, we do need evidence that they are at a UCAS accredited laboratory. Intrauterine insemination. This is a procedure where the healthiest available sperm is introduced directly into the womb. The situations where a doctor may recommend after consultation that IUI would be suitable is if the male partner experiences impotence or severe premature ejaculation. Sometimes it's recommended for unexplained infertility as a first step. Sometimes it's a good treatment if the female partner has problems with ovulation, and we can do something called ovulation induction and then time the insemination of the sperm. And obviously for our single women and our lesbian couples using donor sperm, this is a good first route of treatment. We also offer egg freezing, so probably within the last 5 years particularly, fertility preservation in the form of egg freezing has become more and more popular. Freezing eggs used to not be very successful, but nowadays they've changed the technique that they use in order to freeze eggs, and it is very successful. So it gives a really good way to preserve your fertility for women. Success rates are very good. The frozen eggs are stored in liquid nitrogen. Very recently there was a big change in the law. You may have seen about it in the press. So we used to always be limited to only being able to store egg, sperm or embryos in our laboratory for up to 10 years. And only if you had something that was defined as premature infertility could you extend that storage period. But there was a law change this year, and now you are able to store, anybody is able to store egg, sperm or embryos for up to 55 years, but you do consent in 10-year chunks for that. The reason for egg freezing is mostly social. Quality of eggs are better at a younger age, so more and more women are getting good careers and not ready to have a family at a young age but want to preserve their fertility. We also freeze eggs for women who we know might go into an early menopause, for people who need treatment for cancer which might destroy their fertility. And again, there is counselling offered alongside this treatment. As I mentioned, we have a very large surrogacy programme. I think this year we probably will do 50 cycles of surrogacy, which is a very large programme indeed. Surrogacy is when someone agrees to become pregnant and have a baby for somebody else. There are 2 parties involved, sometimes 3. So we have a surrogate who's going to carry the baby, and the intended parents, who we refer to as IPs. And often we have a third party as well in the form of an egg donor. And it is often the only option for women unable to carry a baby to term, and of course it is the only option for our same-sex male couples. And there's 2 types of surrogacy mostly: host surrogacy or gestational surrogacy, which is what we do most of, where we create some embryos in the laboratory, either with the intended mother's eggs or with donor eggs, and transfer those to the surrogate, or straight surrogacy, where the surrogate will use her own eggs, and this can be done via insemination. Okay, so I'm going to take you through our most common treatment cycle experience and how many appointments you might expect and everything, just to give you a little bit of an idea. And it's an IVF treatment cycle, so you can see that it starts at consultation. You will need to have your screening and your treatment information appointment. We're going to have a look at some ultrasound scans, what amount of appointments and things you can expect, through to egg collection, how the embryo develops in the laboratory, so what's happening behind the scenes, through to embryo transfer, and then your treatment outcome. So a little whistle-stop tour of what you might be able to expect. So in an IVF cycle, and this we refer to IVF cycles, it can include IVF, ICSI or PICSI, and I'll go through those shortly. But the first drug that we use to stimulate your ovaries is follicle stimulating hormone, and it usually starts on day 3 of the cycle. It does stimulate the ovaries to encourage follicles to grow and continues throughout the treatment until 2 days prior to egg collection. So mostly we would say that from the day you start your stimulation medication to the day of your egg collection is approximately 2 weeks. The side effects of the drugs are you can get headaches, mood swings, breast tenderness and bloating. Essentially, they're exaggerated forms of what happens in our natural cycle. So in our natural cycle, we produce 1 egg, and obviously, as we're hopefully producing multiple eggs, we're just gonna feel a bit more like we feel normally when we're going towards the ovulation in our cycle. So you have a scan on day 1, 2 or 3 to assess how many follicles we've got for that month, and we will start your medication accordingly. You'll then come back about 4 or 5 days later for a second scan, and at this scan we will introduce another drug that will stop you ovulating too early. We usually introduce that after around 5 injections, so you will be taking 2 injections a day from about 5 days into the cycle. At that scan again, we will be looking at the follicles within your ovaries and measuring each follicle, and we'll also look, so the picture on the right there is a picture of your endometrial lining, so the lining in your womb, and we'll, so at each scan we measure the lining and we measure all of the follicles within your ovaries. Once you've seen the sonographer and had the scan, you'll go through to see the nurse, who will dispense your medication from us if that's how you're sourcing it, but certainly show you what to do with that medication and how to administer it. After, as I say, after usually 10 to 12 injections, you'll come for your final scan, and this is when we determine the date and time of your egg collection, and it will be determined by the size of those follicles that are growing within your ovaries. Some people are less than 2 weeks, some people are more than 2 weeks, and none of that will affect the final outcome of the treatment. It's just that we're all different. But we will, once they've reached the right size, give you a specific time for a HCG trigger injection, which will allow us to be able to collect the eggs. This will be timed for 36 hours exactly before your egg collection. So if we were scanning you and placing you for egg collection at 9 o'clock on a Monday morning, we would be giving you instructions for your trigger at 9 o'clock on a Saturday night. And all of the instructions that we give you are backed up by written instructions. On egg collection day, you'll expect to be in the clinic for probably 2 to 3 hours. You're admitted to our recovery bay. We will initially record your baseline observations. If you have a male partner, we'll be asking him to provide a sample, which will then go into the laboratory to be prepared. You will see an anaesthetist, because all of our patients are sedated for egg collection via a consultant anaesthetist, so you do have somebody separate looking after your sedation. They will ask you a few questions, and then you will go through to have the procedure completed. Recovery afterwards, probably, it depends how quickly you wake up, you'll probably be here for about an hour and a half after you've had your egg collection before they discharge you home. So a little overview of what I've just been saying in the timeline of the treatment pathway. You get your period, and sometime between getting your period and day 3, we perform an ultrasound scan. And then we start some daily injections of follicle stimulating hormone. At scan 2, we introduce a second injection to stop you ovulating too early. And on the 3rd scan, usually we'll be placing you for egg collection. Once you've had your egg collection, we do supplement what we call the luteal phase up to your pregnancy test with some extra progesterone. So you will be taking some more medication at that point in time. So I'm going to take you now through a little bit of what happens to your eggs and your sperm once we've taken them from you, and what happens within the laboratory. And essentially, initially, I'm going to talk to you about 3 different ways that we introduce eggs and sperm together in the laboratory. IVF, first of all, something called ICSI, and then something also called PICSI, and I'll go through what each of one of those is. So IVF is a suitable treatment when we have normal semen parameters. So you have a male partner who has normal sperm. And normal sperm for our laboratory, they like to define as more than 20 million sperm per mil of ejaculate. Of those, we want 50% of them to be motile and swimming, and we want 50% of those swimming to be progressing well and swimming in the right direction. Most people are quite surprised to learn that a normal sperm sample may have only 15% of normal sperm. It's completely normal for 85% of the sperm within a sample to be abnormal sperm. At this clinic, we also include in our semen assessment something called a HbA score, which detects the maturity of the sperm. And I will go on to explain why we do that a little bit further on when I talk about PICSI. So ICSI is a technique whereby we take a single sperm and inject it directly into the egg. We require that when we have any of those parameters that I've just talked about, so either the count, the way it swims, or the amount of abnormal sperm are outside of what we class as normal. So in that situation, or some men produce no sperm in their ejaculate, but their body is still making sperm, so we can perform a surgical sperm retrieval. But in this situation, we tend to get less, the quality of the sperm tends to be less, so we usually require ICSI in that circumstance. Sometimes the body can make antibodies to itself, and you can be classed as MAR positive. Essentially, this means that you have a normal sperm count, but instead of swimming freely and individually, the sperm tend to clump together, making it very difficult for them to be able to fertilise an egg individually. And previous failure to fertilise. So as I said back at the beginning, we'll always take the results from any previous treatment or investigation that you've had. So if you've had low fertilisation or previous failure to fertilise on a cycle previously, we will always perform ICSI regardless of what the semen assessment is when you come to us. I have got a little video here of how the ICSI technique works. So you'll be having a look. So the needle you can see in the picture there before I play the video. Just bear in mind that that's the width of human hair, and that's the scale that we're talking about. So I'm going to press play. Oh, no, I'm not. No, it doesn't look like that was going to work. Let me just try that again. Oh, here we go. So you can see the sperm swimming up, and in a minute you'll see the embryologist slashing the tail of the sperm with that fine pipette, and that's in order to immobilise the sperm so that they can suck it up into the pipette without it swimming away again. And in a minute you will see that happen. So here we go, this tail is being slashed, and in a minute you'll see the sperm just on the left there, and you'll see it getting sucked up into the pipette. And then we're going to see, so this is now a human egg. You can see the difference in size between the egg and the sperm. Eggs have, for want of a better word, little shells around them. So the embryologist needs to penetrate the shell. So you can see gently just pushing that into there. First of all, they draw back some fluid from the centre of the egg to mix that with the sperm. So you can see it go back, and then gently you can see that they put the sperm back and leave it in there. So the ICSI process doesn't guarantee fertilisation, but it goes a long way to help. So that egg still has to accept that sperm for it to be a fertilised egg. So PICSI is an extension of ICSI. PICSI, we will still take a single sperm and inject it into the egg. But for men who have, so we go back to that HbA analysis that we did within your sperm sample initially to detect the amount of immature sperm within your sample. So for men who have an increased amount of immature sperm within their sample, we would recommend PICSI for the reason that mature and immature sperm look exactly the same to the embryologist down the microscope. However, immature sperm may fertilise an egg, but they'll lead to poorer quality embryos and potential miscarriage and such like. So we get much lower outcomes with immature sperm. In natural conception, the egg would only accept a mature sperm, but we can't determine the difference down the microscope. But by performing PICSI, which is a specially coated dish, it allows the mature and the immature sperm to behave differently within the dish so that embryologists can know that they're selecting the right sperm to inject into your eggs. So we're going to look at some pictures now of what the embryologists are looking at when they look down the microscope. So on the first day after we've introduced the egg and the sperm, whether it be by IVF when we leave them to fertilise by themselves or by the ICSI or PICSI procedure, they're going to be looking down the microscope and wanting to see something that looks like this, which is a normally fertilised egg. You can see two little mounds in the middle, and that denotes that we have DNA from male and female, which is normal fertilisation. We don't look at the embryos on day 2, and we don't very often nowadays look at them on day 3. So if you have 3 or more normally fertilised eggs, we will now leave your embryos in the incubator up until day 5, and we will leave them undisturbed. If we're unsure about whether you will have enough to transfer at day 5, we will have a look at them on day 3 and potentially transfer the embryos to you on day 3. And on day 3, they will have divided to contain between 6 and 8 cells, and we expect them to look like this. And we, as I say, we can transfer embryos at this stage. But for most patients, if you have a good number of fertilised eggs, we will be leaving the fertilised eggs undisturbed in the incubator for 5 days. And when we open the incubator and assess them, we hope to see an embryo that looks like this. This is what's called a blastocyst embryo. And this, you can see 2 distinct groups of cells within this. You can see the ball at the sort of top 11 o'clock. The mass of cells there is what will form the fetus. And all of those cells that sit around the edge of the embryo are what we call the trifectoderm, and they will form the placenta and are important for implantation. So that embryologists will give you a number for how far developed the blastocyst is, and also a grade for each of those groups of cells. On day 6, so we transfer embryos on day 5. The only time we see day 6 embryos in the laboratory is sometimes with our frozen cycles. and sometimes they are hatching out by then. So on the left-hand side, you can see the first one is starting to hatch. Second one, where it's formed a figure of 8, it's just half hatching. And the picture on the right-hand side shows the embryo that's completely left its surrounding shell behind. So as I said, the day of embryo transfer will be based on the number of fertilised eggs, essentially, and also the number that you would like to be transferred. So we can transfer 1 or 2 embryos, depending on your circumstances. We do perform embryo transfers 7 days a week, and when you're looking at clinics, it's important that your clinic transfers embryos 7 days a week. It means it maximises your chances of pregnancy by meaning that you're having your embryos transferred on the day that your embryos dictate rather than the day that the clinic programme dictates. You will be given an opportunity to see your embryos and to take a picture of your embryo or embryos away with you. We do offer something called embryo glue alongside our cycles. Really, this is for patients who have had, if you're coming to us and you've had previous implantation failure, it's something that we can offer, which is a transfer medium that mimics the conditions in the uterus, and it kind of primes the embryo prior to transfer, so it's not actually adhesive. In the clinic, I think one of people are always worried about whether their embryos could be mixed up. You'll be reassured to know that we have an automatic witness system within the clinic called IVF Witness. We still have to, so the law in the UK is that every movement of egg, sperm or embryos within the laboratory has to be witnessed by 2 humans, and that still is the case. But what the IVF Witness system does is it will have an electronic tag on all of the dishes that are used within your treatments containing your egg, sperm or embryos. That is unique to you. And it means that when the embryologist gets a dish out of the incubator and puts it under the hood, if it's a mismatch of any kind, then it will alarm. So it's just an extra safety procedure for you. It also provides traceability of every procedure that's happened within the laboratory and who's carried it out and what batch number of everything that we've used. So it is very reassuring for our patients. Regardless of what treatment you've had, we hope that we end up at this stage. So we do perform early pregnancy scans. We offer routine pregnancy scans at 7 weeks, and at a 7-week pregnancy scan we expect to see the picture on the left. So we expect to see a fetal pole, which is the little line, I suppose, there, the little blob, and the ring at the top is something called a yolk sac, and that's what we're expecting to see. Incredibly, 3 weeks later, when we scan at 10 weeks, and that is a 3D scan, we would expect your fetus to have arms and legs and look like that. So we offer 2 early pregnancy scans, 7 weeks and 10 weeks, and then we would discharge you to routine antenatal care. We do also, alongside the 10-week scan, offer something called a NIPT test, which is a blood test to give you 99.9% idea of the 3 main trisomies within pregnancy, which is Downs, Edwards and Patau syndrome. So, and it can also sex the baby. So we do offer that, and it is quite a popular test. So funding options. We are able to see, we do have an NHS contract to see NHS patients, but if you don't have funding, there are other ways. So we have egg and sperm share programs for funded IVF. They include saline infusion, screening and fertility drugs, so that the egg share program is inclusive. That egg sharing is where you would donate half of your eggs collected from a treatment cycle in order to fund your own treatment. So you donate anonymously to one of those people that we were talking about when we were talking about donation, and in return you receive your own treatment, heavily discounted, and most parts of it would be completely funded. We also offer actually egg sharing alongside egg freezing, so if you're looking at preserving your own fertility, you can also share your eggs with that too. So generally, if you are paying for yourself, what does treatment cost? So the costs vary. The costs that are set out here are the cost for the actual treatment. On top of these, you will pay for screening, you will certainly pay for medication on top, and you'll probably, for your IVF and ICSI cycles, you would probably expect to pay £2,500 to £3,000, up to £2,500 to £3,000 for different bits in addition to the cost of the actual treatment. So just so you're aware. So we've got the cost of IUI, IVF, ICSI, donor eggs. That is pretty much an inclusive cost, I would say. Our donor sperm costs £1,000. As I said when I was talking about fertility assessment, there's a couple of different options for you within that. So the cost can go anywhere from £210 to £690. We do a package for egg freezing, so if you're looking to preserve your fertility, you can have a 3-cycle package. As I say, the costs vary and can be quite individual, so it's worth bearing that in mind. We also do have a partner called Access Fertility, who offer funding packages for you to help plan your treatment. So they offer an unlimited cycles within a 2-year period for a fixed fee. They offer a refund package where you get your money back if you don't achieve a pregnancy, or you pay for multi-cycles up front or for donation. So they are accessed separately. You need to have a consultation with us first of all, and then contact them, and they will contact us then for your medical information. We're very keen on emotionally supporting our pregnant patients at Herts Essex. We have a patient support group. We also support our staff with wellness. And you will see there's lots of forums and things on our online with social media for support. So we very strongly recommend that you access all of the support during your journey that you can. We also like to talk to you about diet. So back at the beginning, I talked about Fit for Fertility. Alex is our dietitian. We can refer you directly to her, so she can have one-to-one consultations with patients. She can make a plan for your nutrition, or you can access some of her sort of ideas on being fit for fertility on the Fit for Fertility website. She does a monthly blog for us, so she really is passionate about nutrition, so that's often a very good source of information. So why us? So we are pretty experienced at 33 years. We do provide a 7-day-a-week laboratory service, which, as I said, is one thing that you must look for within a clinic. We provide the extra safety of an electronic witnessing system. We have produced lots and lots of lovely babies. We hope to support you throughout your treatment. So, as I said, we're a fairly small team. You will get to see most of us throughout your treatment, and you will see familiar faces when you're coming into the clinic, and that does allow us to provide extra emotional support for our patients. As I said at the beginning, we would love you to complete a short survey to let us know how we can improve the event. That link will be coming up in your Q&A chat that's happening along the side of your screen, and you will also receive a link by SMS tomorrow for that. As I mentioned, we're active on social media, so we're on Facebook, Twitter, LinkedIn and Instagram. You can access information from us. on there. And if you did want to book an appointment, as I said, it's a self-referral process, so you can pick up the phone and phone us. We have an inquiries line, so if you prefer to access us online, you can email us tomorrow. An initial consultation appointment, which includes the AMH, thyroid tests and a semen assessment, is £400 in the clinic. And currently our wait list for a consultation would be available in about 4 weeks' time. So it remains for me to say thank you so much for your time this evening. I hope it's been useful information. In the old days before COVID, you used to come into the clinic and we used to take you around for a little tour, but we now have a virtual tour. So I am going to hopefully play a virtual tour of the clinic for you so you can have a little look around. And there will be live questions and answers on probably for about 10-15 minutes afterwards, so do keep going with your questions. As I said, thank you very much for your time.